Good morning, everyone. This is Morgan with Positively Osceola here for our morning segment with Positively Osceola's Daybreak Live. So excited to be coming to you guys this morning with our Daybreak Lives. You guys already know I love these segments. Always exciting to have exciting guests joining us. Very excited this morning to have Belinda Johnson-Cornett, who is the CEO of Osceola Community Health. She's going to be sharing some wonderful information that is much needed, especially this time of year and the past year we've had. So be sure to say hello whenever you hop on. Hit the thumbs up button, hit the share button. Let me know who we have with us this morning. I hope you guys are having a wonderful Monday so far. It is January 18th. Very excited to be kicking off a new work week. So hopefully you guys have a great week ahead of you. I'm going to come on here and share this video so that everyone hears of the wonderful things that Osceola Community Health provides the county. So be sure, like I said, to be doing the same. The thumbs up button, the share button, all that kind of good stuff. Have some wonderful things to share with you guys. So very, very excited for our segment this morning. Like I said, Miss Belinda Johnson-Cornett, the CEO of Osceola Community Health, going to be sharing some wonderful information that's very useful. So without further ado, we will go ahead and kick off our Daybreak Live. Alrighty, guys. So like I've been saying, very, very excited to welcome our special guest this morning to Positively Osceola's Daybreak Live, Miss Belinda Johnson-Cornett. Good morning. How are you?
Hi, good morning. How are you?
Doing great. Thank you so much for taking time out of your schedule to join us here on our Daybreak Live. You are the CEO of Osceola Community Health, which is a wonderful organization and service that we have right here in Osceola County. So to get us started this morning, tell us about Osceola Community Health Services. What is the history within the community? Who do you serve? What services do you provide? And all that good information that we're loving to hear this morning.
So Osceola Community Health Services has been providing healthcare services in the community since 2002. Originally started the health center in Ponciana. And it started in that site in a trailer, actually.
Oh, wow.
And some years later, we received funding, federal funding, to build initial modular and then a two-story building, a beautiful building, which is located on Dover Plum Ave currently. And so we provide healthcare services to all ages. And we've been providing, making sure that everyone has access to healthcare. And so that's our mission, whether they're insured, uninsured, or underinsured. We want to make sure that everyone receives the care that they deserve and need. And we are Joint Commission accredited, which means that an accrediting body monitors our quality assurance and our quality programs, ensuring that our infection control and safety measures are on par. And we also are certified as a primary care medical home. So we provide a home just like a private provider. So we have a private care provider. We have some board certified providers that work with us. And so we provide care for primary care, maternity care. We have a large dental program. We provide behavioral health services as well, and a full range of women's health services.
Wow, that's absolutely incredible. With all of the wonderful services you guys provide, like you just mentioned, how many people would you say that you serve each year, and what is the age ranges?
So we serve about 22 to 25,000 patients each year. And with that, and so each patient gets multiple services. And so we provide wraparound services the whole goal is to be a one-stop shop so that we can try to provide as many services as possible on site. And so it come out to about more than 50,000 services that we provide each year, all ages from newborn to older adult.
That is so, so incredible. Now, where are your clinical sites located?
So we're strategically located throughout Osceola County. And so we've been expanding, like from starting off from Ponciana. And so some of our services, we'll talk about Stadium Place, which is right here on Bill Beck near our administration office. And we provide full services there. Ponciana is the building that I talked about that we had built some years ago. And so for that community in Ponciana, we ensure that we provide a full range of services there also. We have a site at St. Cloud on Grape Ave. We have a site, Intercession City, is in Business Center Lane in Kissimmee as well. In BVL, we have a site on Simpson Road. We have a dental site in Kissimmee. It's primarily for pediatric dentistry at this particular location. Cameron Preserves is a private partnership, public partnership with the county, and we actually provide a service right there in the low-income housing unit, and again, to try to meet people where their needs are. We also have a satellite site, a Council on Aging. Backlot Apartments is a new site that we've actually begun at, and that is the kind of low-cost utility type of services there, the apartments there. And so we provide on-site telehealth as well as face-to-face primary care. Again, we try to be in the neighborhoods to ensure that people who have issues with access to healthcare are able to receive the care that they need. And then we also are doing a lot of telehealth now, particularly with the COVID pandemic.
Absolutely.
And then we have a program called Phone to Home, where we work with community partners, including EMS, to identify patients who may use the emergency room because they don't have any other option. So we try to connect with them and do an assessment to see what their needs are and connect them to services, our services, but also services in the community that we don't provide, services with housing and food, but it's making sure that patients are receiving the care that they need at the level that they need it.
Right, absolutely. Now, do you guys provide any mobile services?
We do. We have a brand new mobile unit that we started getting out in the community before the pandemic hit. Right. The plans are to get it out again and provide medical services, again, outreach into those communities who may not be able to get to us. Right. We also have a dental mobile unit.
Oh, wow.
Yeah, we had begun services in Halapaw and Kenansville, trying to outreach into those areas where people may have transportation issues. And then a new site that we have coming on board is located near Advent Health off of OBT on Hilda Ave. Okay. And that will be opening up in March. And so we'll have more information to come on that.
Oh, that's so exciting. A big question that's often asked in healthcare is in regards to insurance. Do people need to have insurance, and do they need to be U.S. citizens to qualify for the services that you guys offer?
So the answer to both is no. So you don't have to have insurance, but we do accept insurances, all major insurances. But if you do not have insurances, we provide care based on the patient's ability to pay. Wow. And we provide a sliding fee scale. So someone could have an appointment that, would cost them $300, but with us, it may just be a $20 nominal fee.
Wow.
And so including labs and other services. And as far as U.S. citizenship, we don't require them to be citizens, and that information goes nowhere. And it's not a qualifying thing to have.
What an amazing service that you guys are offering. Now, if there's someone that's watching this morning and they're looking to maybe make an appointment or find more information about the health centers, how do they do so?
They can call 407-943-8600. And if they don't have insurance, they'll be connected with an eligibility staff person just to take some information and determine what level of payment they will have, if any. Other than the nominal fee. And we do have the nominal fee so that makes sure that people really take pride in the healthcare that they receive and understand the value and quality of that care.
Right. Absolutely. Well, thank you so much, Ms. Belinda, for joining us this morning on the Positively Osceola Daybreak Live. Thank you for all that you're doing here in Osceola County and all that you guys continue to do as time goes on here. So we're so thankful for you and all the wonderful services that you're providing for our county.
Thank you. I appreciate your time this morning.
Yes, ma'am. Thank you so much. To sign off this morning, this is Morgan with Positively Osceola here with Miss Belinda Johnson-Cornett, who's the CEO of Osceola Community Health. And together we're making a positive difference in and around Osceola County. Bye, guys.